In much of the Asia-Pacific region, mental health problems go unrecognised and untreated. Yet mental illnesses account for 5 of the leading 10 causes of disability in the world today.
In vast tracts of the world, perhaps the majority of the world, there is no psychiatrist for most people, or if the psychiatrist exists, he or she is usually inaccessible.
There is no doubt that countries in the Asia-Pacific region are poorly resourced to deal with mental health issues. In an effort to tackle the problem, the University of Melbourne and the Harvard Medical School have joined forces to create the International Mental Health Leadership Program to strengthen mental health services around the region by training, mentoring and encouraging young professionals in psychiatric health.
This is a small sample of the media response to the first International Mental Health Development Conference held in Melbourne in October 2002. The conference was the culmination of the first year of the International Mental Health Leadership Program and highlighted the research and service development achievements of a unique group of young professionals who are undertaking the program. The mental health challenges faced by countries of the Asia-Pacific region and the work of the first group of fellows in response to these challenges attracted enormous print and electronic media attention, with reports being broadcast across the entire region. The University of Melbourne Harvard Medical School International Mental Health Leadership Program is focusing on the critical role of leadership in putting population mental health on the agenda of governments and communities throughout the developing world. An international faculty, led by the University of Melbourne and Harvard Medical School, works with mental health professionals in the Asia-Pacific region to strengthen capacity for mental health policy and service development and to improve the scope and quality of health systems research. The program is building a network of talented and committed mental health professionals and key regional academic and other institutions that will contribute substantially to improving mental health services and mental health promotion programs. The members of the network are supported by the program faculty and support each other in this vital work. The one-year period of intensive training is followed by continuing participation in network programs and activities, building momentum for mental health developments in the region. The International Mental Health Leadership Program is a collaboration between the Centre for International Mental Health at the University of Melbourne and the Department of Social Medicine in the Harvard Medical School. Partnerships have also been established with the London School of Hygiene and Tropical Medicine, the University of Queensland and the University of Western Australia, with senior colleagues from these institutions teaching in the program and supervising fellows. A partnership has also been established with the World Health Organization. The program now constitutes one of the key components of the WHO Mental Health Global Action Program. The Centre for International Mental Health is a WHO collaborating centre. The Centre and the WHO Department of Mental Health and Substance Dependence in Geneva have jointly established the iMHLP WHO program for training in mental health policy, service development and research. This will enable WHO fellows to undertake the leadership program. This is a unique program with a formal training component now being offered as a University of Melbourne Master of International Mental Health degree. The curriculum is designed specifically to meet the needs of developing countries. The mixed mode of delivery, including face-to-face teaching and intensive seminars, regional workshops and online seminars, ensures that fellows do not spend too much time away from where they are most needed and that they do their research and service development projects in their own home countries. Professor Byron Good.
So an honor to be a part of a program with Harry Minnis that has grown over the last year and that has come to a certain kind of conclusion and fruition in the work that we heard about yesterday and look forward to hearing about through today, and of course look forward to following for many years to come.
Fellows come to Australia for intensive seminars at the University of Melbourne. The teaching modules include global mental health development, mental health policy development, mental health services design, research, methods, ethics and uses, health services research, and mental health promotion. During the delivery of these teaching modules, members of the faculty guide the fellows in the design of a research or service development project that addresses critical needs in their home countries. A year-long project supported by a faculty supervisor, a senior colleague in the home country who acts as a mentor, and the advice and the assistance of former fellows. Additional support includes a comprehensive website featuring all the modules, links and resources, online bulletins, email discussion groups, as well as traditional written resources such as newsletters and program reports. All of this material is now also available in a fully integrated CD-ROM, as well as the full program lectures on DVD. The ready availability of these learning resources is of continuing usefulness to the fellows, as well as serving as a valuable teaching resource that the fellows can use to teach the material in their home countries, run train-the-trainer initiatives, or engage government, community and the media. This product streamlines teaching and access to the program with video footage of seminars, workshops and lectures, original text, graphics, notes and PowerPoint slides, as well as key reading materials and primary resources on the web. The entire electronic library of teaching materials can be accessed from this single user-friendly platform. If we're going to be active in thinking about how we can improve the mental health of populations, we have to pay attention to all of these domains. We have to kind of lift our gaze from the clinical situation to think about the mental health of populations and the systems that are required to be put in place in order to deal with population mental health problems.
Now, the role of governments in forming health policy is particularly tricky because governments work in a globalised world where governments take account of the impacts from outside as well as the things we've been talking about, which is the impacts from within inside their nation.
A general research question or objective cannot by itself give you an indication of how many people you need in your study. Only a hypothesis can. Now, for those of you who will be doing or interested in hypothesis-driven research, when you frame your hypothesis this afternoon.
This is the Atlas project. It's the first version I've actually seen of the Atlas, which goes through every country in the UN.
With seamless web linkages, it also provides up-to-date profiles and contact details of all participants, faculty and alumni, as well as their key research and service development endeavours. The annual International Mental Health Development Conference will expand opportunities for fellows to present the results of their research and service development work to regional and international colleagues and to strengthen the network.
Because I think that the overall background of psychiatry that I have described is important for the outstanding effort that you're doing in this course and in this, with the fellows who are here. I think that much of the hope is that they will be the agents which will break those cycles in one place or another, at one time or another.
The other half of the story is that we establish these partnerships I've talked about, and that we continue to advocate quietly, steadily, and tenaciously to make a change. Thank you.
And somehow in the leadership program, there must be some point where you address their own needs to get their bosses know that they're not going to be really threats, they're going to be the jewels in that department or in that country, and therefore they
There's a huge and growing literature on what we call days out of role. That's people who are no longer able to fulfil their social role, including remunerated employment or paid employment, because of their mental disorder or psychiatric disability.
Well, I'm glad to see so many nationals from different parts of the world in this conference. In many ways, it's an expression of the cosmopolitan richness of Melbourne.
You know, China is such a huge country, and the socio-economical development is various in different places. And you just couldn't set one rule which can be used everywhere.
Big advantage of a particular program like this. It's investing in individuals, it's investing in their future, it's investing in a sense in them as future representatives for the facts of mental health, and it's investing in them to provide them with opportunities together with their colleagues to be able to fight for mental health.
We at Lilly consider the Melbourne-Harvard program an outstanding example of a regional program dedicated to developing the next generation of psychiatric leadership in Asia. We celebrate your success and look forward with great enthusiasm and with high expectations. Thank you.
The work of the International Mental Health Leadership Program builds on a growing awareness of the importance of mental health and of the inadequacies of mental health systems. There is a growing commitment by the international community to act. The burden of human suffering and the death and disability caused by untreated mental disorders in the developing world can no longer be ignored. Few countries in the region have the necessary human and health system resources to respond effectively and equitably to the needs of their populations. In such a context, there is an urgent need for collaborative action and for effective leadership. The International Mental Health Leadership Program will strengthen capacity in the Asia-Pacific region to take the necessary action and to foster leadership.